and thank you to our provider community for joining us for our second town hall for EVV related to HHCS. This town hall will go over some of our frequently asked questions that we had from the initial kickoff. In addition, we will uh, be working to give a little bit more insight on the onboarding process. All of our agencies should have received that initial contact from Therap. And if not, we will have a little bit of direction in the deck on the next steps if you haven't, as well as discussing um, claim the claims portion and aggregator, and just a little bit more of our training process. And there will be outlining that. And then just a reminder that we will not be taking live questions, just to ensure that we have responses, and we will be posting those question and response. Therap is also going to be posting those to our site and their EVV site for Kentucky. So we will ensure that everybody has the correct response, and we will ensure that we get those posted. And for now, I will turn it over to Jason. Thank you.
All right. Thank you so much, Pam. And thank you for all of you guys for joining us again this afternoon to talk about Therap and Kentucky EVV. Hopefully, many of you guys were able to join us back on the 29th, about a week and a half ago for our initial town hall. But for those of you who were not able to, again, my name is Jason Laws. I am one of Therap's leads for the Kentucky EVV project, which essentially means in many ways I'm kind of a liaison between Therap and the provider community, helping you guys go through the onboarding process while at the same time working directly with the state to make sure we've got everything in place in terms of requirements and making sure that all the necessary information gets to you guys. So it's a pleasure to be with you again today and to kind of outline some of the steps that we've got coming up. As Pam said, today's call is really still going to focus a lot on kind of the onboarding process. For those of you that were on the initial town hall, you know, we talked a lot about that. We gave a full overview of our EVV platform and talked a lot about our aggregator, a little bit about the optional billing and claiming that you guys have available to you, kind of all of that stuff, and really went over a lot of information. Today is going to be a little bit more concise, probably ultimately going to be a shorter call, which I don't think anybody will be too upset about. But really what we want to do in many ways is to really reiterate some of the messaging that we gave on the first one. We know a lot of you guys are either just beginning your onboarding process with us, kind of responding to the initial messaging that went out to everyone. Some of you may be hearing this and you're like, what messaging? I didn't get anything. Well, we're going to help you guys out today too. So we're going to focus on that kind of stuff so that, again, just to cover the expectations of what's going on and what the next steps are. So you guys kind of know what's to come. So with that, here's an agenda. I am going to touch on the basics of our project and timelines for those of you that may not be as familiar with it. But again, we're going to focus largely on the expectations and the training content of what we have coming up soon. And then we're going to talk about the frequently asked questions. We got a great deal of questions from you guys, which was fantastic, through the chat during our initial town hall. And what we've tried to do, I've worked along with the Therap team as well as the Kentucky State team to really consolidate that information and bring it together into a format that we could kind of share back to you. I will go ahead and tell you some of the questions that we're going to cover today on the call. We're not going to cover every single question that was asked. We'd be here for quite a while. But we are going to talk about those that popped up quite a bit, those that seem to be most of interest to the provider networks. We're going to talk about those publicly today. We've got all of our responses up. I've got that information on these slides, so you guys will see that coming a little bit later in the call. And then the Q&A with attendees. It's a little bit of a misnomer. Probably should have rethought kind of how I labeled that part of the agenda. As Pam said, we're not going to answer questions publicly quite in the same way that we did last time, because we want to make sure we organize our responses and are managing all the information that gets out. Having said that, we definitely do encourage you guys to utilize the chat function within Teams to ask your questions, because we're, as Pam said, we're going to collect that information, pull it together, and continue to update our frequently asked questions both on our site as well as the state site, so that you guys have a resource to be able to get to that information. So again, that's kind of the overview of what we're going to be doing. So let me start out again with a very, very high level overview of the project itself. And so again, hopefully everybody knows this by now, but in the event that you weren't able to make the last call, and this is your kind of introduction to Therap, we are the selected vendor for electronic visit verification for you guys as home health services, and ultimately next year as personal care services for the state of Kentucky, meaning that the state is providing you the Therap electronic visit verification platform to utilize to collect EVV data within your organization. Now, to be absolutely clear, you are not obligated to utilize the Therap EVV platform. We'll talk more about the options you have available to you in just a moment, but it is being made available to you at no charge by the state of Kentucky. And so we're here to support the onboarding of that process for those that want to use it. And then for those that choose not to, we're also going to support you with the use of what we generally refer to as third-party vendors, which are essentially our alternative electronic visit verification platforms. If any of you guys are already using an EVV vendor, or you have another vendor that you would prefer to utilize their platform, you are certainly welcome to do so, assuming they meet the standards associated with that third party, with being a certified EVV system, I should say. And so we're going to support you through that, get you the information that you need, and go through the testing to make sure that that works. Ultimately, whether you're utilizing Therap's EVV platform or you're utilizing your own EVV platform, you're all going to be sending data to the Therap aggregator, which you see there in the second bullet. This is kind of the second part of the contract that we really want to make sure that folks have a good understanding of, because we absolutely understand that this can be a little bit confusing. And so the best way for all of you guys to think about it is that effectively Therap is providing to you two separate applications, two separate tools that you have, one of which you have the option of using, and that's the collecting of the EVV data. You can think of it as kind of the front end data entry piece. The other piece is the Therap aggregator. And so what the aggregator is really a repository of information, a repository of EVV data that can collect data from Therap's EVV platform or from other third-party vendors. All of that data comes together within the Therap aggregator, and then that's the data that's used to validate claims and really meet the overall goals of what EVV is to accomplish. So those are kind of the two parts of the contract that we are providing to the provider network within Therap. Now, again, this project is going to have two phases, and we're certainly at the beginning focusing on our home health services, which I expect is who all of you guys represent. So we're going to be focusing on that. And you're going to notice something on this slide that may kind of jump out at you because it's a little bit different than maybe what you had seen before. And that is the go live date that you now see as 12/28/2023. And what I think I'll let the state of Kentucky do, in particular, Pam, if you want to talk a little bit about that change and explain to folks. It doesn't mean we stole 3 days from you. There's a little more nuance than that, but I'll let Pam explain.
Right. So we, for consistency with kind of some of our internal presentations and communications with CMS, and when we actually are going to bring the system up and live, we've changed this date to 12/28/23. Does that mean that you don't have until 1/1/24 to begin use? No, you all can still. We will. The official required mandatory date for the EVV HHCS project is 1/1/24, but the system will be live before that date. And so we'll talk through as we get through the trainings and as you're onboarded, when you all actually can start using the system. But we wanted to align our dates just so that the presentations and things were consistent. So it doesn't mean that for all of you who may be like me and are procrastinator, and I'm going to wait out to that very last date, that you don't have till 1/1/24. You still do. That is the mandatory go live date still, but we will be live before that actual date.
Yeah, thank you so much, Pam. And certainly as we continue to go forward, we'll reiterate that in our communications and definitely feel free to ask any questions that you guys have. So with that said, kind of want to bring up now just kind of that broader timeline. Most of you guys have probably seen this before, or at least a general version of it. As you can kind of tell, where we are right now is right in here in October. And so the steps to this point is we've obviously, on the therapy side, spent a great deal of time working with the CHFS team here in Kentucky, doing all of the planning and preparations for onboarding. We conducted our initial town hall a couple of weeks back to introduce the project to folks. And really now we're moving in earnest into the provider onboarding piece of the project, which essentially means getting you guys all up and set up with your therapy accounts to get onboarded so that you have the things in place. And then we'll move into the formal training for both your administrators, your schedulers, getting all of that stuff set up within your therapy account, and then ultimately to the training for your caregivers and direct support professionals, the folks, the foundation of what we all do, the folks that are providing that frontline service to individuals. And so that's kind of what we'll be working through over the course of the next 2 or 3 months, again, with that 12/28 go live date. Again, as Pam said, we'll probably say this a dozen times on the call today, that you guys will not be required to utilize EVV until 1/1/24, but it will be made available a few days prior to that, which is why we've updated that date. So again, that's kind of a high-level overview of the project and what's to come. But again, as I said earlier, what we really want to focus on today is kind of to reiterate some of those onboarding processes and expectations of what's happening right now and what's going to be continuing to happen over the course of the next couple of weeks. And that is kind of how are we going to get you guys into the therapy system and ready to go if you choose to utilize therapy EVV, or if you choose to utilize the third-party system, how to get your chosen vendor certified. And so that's where we're going to focus the conversation for the remainder of the call today. So again, and I know I'm repeating myself, but I really want to make sure folks have a good grasp of this. So I'm going to say it a few times. I want to make sure that folks really understand these two options that you have available to you of either utilizing Therap as your electronic visit verification platform at no cost provided by the state, or the ability to utilize your an alternative vendor for EVV that can then send data to the therapy aggregator to meet the obligations and requirements of the Cures Act and of the EVV requirement within the state of Kentucky and federally. So those two options are available to you. Part of what you're getting from us, and we'll talk about a bit more here in just a moment, is a questionnaire that's going to ask you to kind of categorize yourself into what is your chosen approach here. And then based on that, we will walk you through the necessary steps to get you onboarded so that you can begin collecting that EVV data and get it over into the aggregator. Now, once you've made that selection, let's talk a little bit about some of the things that are going to be associated with the onboarding and training process. And a lot of the activities that you're going to fall in, virtually all of the activities you guys will be involved in, is going to fall into one of the 3 buckets that you see on the screen. First of all are the town halls. This is the second of a series of town halls that we're going to continue to do throughout the entire fall leading up towards the go live date. Really, the intent of these calls is to provide you guys ongoing the information that you need to be able to get onboarded, to get you the training information that you need, and really make sure that you're supported, as well as have an opportunity to share questions that you may have about the process. That's really the intent of these town halls, and we're going to continue to do them. As I mentioned last time, here, these first few, we're going to have a fairly structured agenda for the town halls. As we continue to move forward, we'll continue to tweak it based on where we know the provider network is at, based on the feedback that we're getting from users, just to make sure we're continuing to meet the changing needs of folks as they proceed through the process. So that's the town hall. The onboarding itself. Now, how do we get your account set up and get you guys into using Therap, collecting data, and all of that piece? Well, the onboarding process is really what starts with the setting up of one-on-one sessions with our Therap specialists and your particular agency leads, your administrators, the folks who oversee your EVV services, your schedulers, to create your Therap accounts and to get in there and really configure them to represent the services that you provide. So it's really the preparation of those accounts to reflect what are the particular services that we provide via EVV. How do I get my particular individuals that I support into the system? How do I get all of my staff in there and make sure they have the proper credentials to do what they need to do? It's really kind of that under the hood administrative setup of your account. And we're going to have a team, or we have, I should say, a team of folks on the Therap side that are basically just waiting for your information to come in. They're going to be scheduling those one-on-one calls with you to take you through the process. Then the final piece is the actual training. And while there's obviously some overlap between the onboarding process and the training, what really distinguishes it, at least from our perspective, is that the onboarding is the setup. The training is showing you how to use it. How do I go in and create a shift for my staff? How does my staff know how to use Therap's mobile app to check into a service, to check out of a service, and document what they need to meet the EVV requirements? And that training is going to get provided in a variety of ways. Some of it we're actually going to incorporate into our town hall so that you guys publicly are seeing some of the steps associated with that. We got a team of specialists last week, or excuse me, on the last town hall. We had a couple of our specialists come on and kind of do a walkthrough of the EVV application, as well as our optional billing system that you guys could choose to use if you want. More on that in a minute. But we're going to continue to bring those specialists in to really give you some step-by-step instruction on some of this as we continue to proceed through. All of the other training materials we're going to be providing to you are going to be a more what we refer to as an asynchronous variety, meaning they may not be live, but they will be recordings of other trainings that have been provided. They will be training resources, which we make available on our site. I'm going to share that site with you here in just a few minutes, which provide very detailed user guides for how to utilize all of these things. It's also going to provide you with contact information for additional questions and that sort of stuff. So these are really the three, as I said earlier, kind of the buckets of activities that you guys are going to continue to be participating in over the course of the next few months as we go through this onboarding process. So to the onboarding process itself, how does this work? First of all, let me go ahead and say that several of you have already submitted your information. So we appreciate you guys that have been responsive to that initial messaging that we sent out, right? Or not immediately after, but last Monday morning, I believe it was, we sent out our initial messaging to all of you, which was the job form that you see on the screen, where you're going to categorize yourself, as you can see here, between the four choices, between either a current user that's going to use Therap's EVV solution, or an existing, excuse me, I should say an existing Therap user that's going to use our EVV platform and aggregator, or an existing Therap user that's going to use it privately and then send information to the aggregator. I don't think we actually have anybody on the home health side that fits in these two categories. So really, for today's purposes, we're going to focus on the third and fourth category, which are folks that have not used Therap before, but in order to meet the state's requirements, are either going to use the Therap EVV solution, and then we're going to show you how to get that set up and send data to the aggregator, or have chosen to use a third-party vendor, meaning your own selected vendor that you're either already doing EVV through or you intend to do EVV through. So you're going to indicate to us which of these categories that you are, and based on that, you're going to get a series of questions where you can go and submit that information. That information is going to come to us, and based on the responses to these questions, we are going to follow up with you in accordance to the category that you placed yourself in. If you're going to be one of the Therap EVV users, then you are going to get a Calendly link to set up a one-on-one time on a schedule with our support specialist to walk you through the account setup, and we'll take you from there. If you are going to be using third party, then you're going to get a link to us. We're going to send you some business user agreements, ask for some information about your third party vendor, and move through the process from there. But we will get you the necessary information that you need based on how you categorize yourself. Now, many of you may be thinking, and I've already heard from some of you over the course of the last week or so, that, well, I didn't see that information. That didn't get to us. Well, like every listserv, the unfortunate reality is sometimes a name or two here and there might get missed, or somebody's email might go to spam, or it might have gone to the wrong person within an organization, and that's perfectly fine. We expect some of that. So if you or your organization have not yet been contacted about onboarding activities from Therap, please reach out to us at the 2 email addresses that you see on your screen. The kysupport@therapservices.net. That's going to go directly to our group internally. We will follow up with you directly to get the information that you need. Kentucky is also requesting you guys may use the Medicaid public comment email at ky.gov. If you're not hearing information there, you can certainly note that, and we'll be following up with each other, essentially just to make sure that all of you are getting the information that you need. And really what we want you to submit through these email addresses, obviously, is your name and contact information, but also the name of your organization and your provider number. One of the things that certainly we've noticed as we've initiated onboarding activities is that there may be some of you, some administrators who oversee multiple entities. You may have multiple providers that you work directly with in home health. And if you have multiple, please indicate the names of all of those entities in the email that you send, as well as the provider numbers, and then we'll follow up with you to get that ironed out and to make sure that your accounts are getting set up to reflect the multiple entities that you may represent. So please, if you have not yet heard from us, send that information in. We've got folks monitoring these things very closely so that we can follow up and get you the info that you need. Once you get that information and you submit it in through the job form, I want to take a few minutes to talk a little bit about what you can expect. As I said, if you're choosing to utilize Therap's EVV platform, you are going to get a calendar invite where you can set up a scheduled appointment, a one-on-one appointment with one of the Therap team members, one of our specialists, to get your account set up. And this is essentially what you see on your screen. These are going to be the steps that they're going to take you through. On the first call that you have with our folks, we're really going to be focusing on that basic setup of a Therap account. We're going to focus on creating you or your designee as what we refer to as the super administrator for the account, which is kind of the super user to get logged in and set up. And then we're going to take you through the steps of really configuring your account in preparation for bringing in individuals and setting up your EVV. We're going to focus on things like programs and sites within our accounts. Effectively, that's referring to the services you're providing in the locations where they're centralized. Obviously, we know a lot of services are provided out in community settings, and we'll work with you to set up that information in a way that best reflects the services you provide. We're obviously going to work with you on getting individuals into the system, going in and creating individuals. We also want to make sure you guys are aware, and certainly our support team members will work with you on this. We also have the ability to do some importing of data if you have that data in spreadsheet format, CSV format, that kind of thing. Our support team can work with you on that to help expedite that process if you happen to provide services to a large number of individuals and don't want to have to go in and create them all manually. We can certainly show you how to expedite that. Similarly, we're going to show you how to create your users in the system. So basically, these are your staff kind of throughout the organization, everybody that's going to be involved with your EVV services, certainly from your administrators to the folks that are creating the schedules to the actual caregivers on the ground providing service, how to get those users in there. And just as importantly, get them set up with the appropriate credentials to perform the actions that they need to be able to perform within the system. The entire Therap platform is built off of a role-based level of access, such that each user that logs in is going to see the particular individuals they work with. They're going to be able to perform the particular actions that they need to perform, and that's it. We don't want folks having access to the entire system if they don't need access to the system. They're going to be able to see and do the things they need to see and do, and we're going to show you how to set it up within our role-based access. So that's largely the focus of the first call that you're going to be doing with us. From that point, our folks are going to then schedule a second follow-up call. They're going to give you some time to go in and do some more of that setup, and we'll come back on to the second call and answer any questions and confirm what you've done to that point. But then they're going to focus on the actual EVV configuration. And so what I mean by that is going beyond just the creation of individuals and the creation of staff. It's about configuring the account to reflect the EVV services you provide. So what are the specific service descriptions that you're going to need to utilize and set up for EVV? How do you set up service authorization for individuals receiving support? so that you can go in and select the service being provided as part of an EVV scheduled shift. You'll be able to set up your users and identify which services they can provide, which caregivers or what services each of your caregivers can provide through EVV. It's really kind of all of that under the hood configuration that they're going to be walking through with you guys as part of that second call. And that will really get you to the point of being set up with the EVV platform. Now, the last call, and I realize I messed up my numbers here. We've got 1, 2, and 2 over here. There should be a 3 down here. The third call that is optional, depending on what you guys choose to utilize, is a focus on the Thera billing system. Now, without going into a ton of detail on here, just kind of quickly to help folks understand, as part of the state contract, we are also able to offer you guys a mature billing system that allows you to direct claim to MMIS and the MCOs directly from your from your EVV data that is captured within Thera. Now, you are in no way obligated to use that. You can continue to submit claims in the way that you do today, either through an internal system that you have, going through the state portal, whatever the case may be. That is certainly up to you. But if you choose to utilize Thera's claiming process, we will support you to get that set up as well. And that's really the focus of the third call there. We have one of our billing specialists who actually happens to be on the call today, Kelly Galloway, who will be working one-on-one with you guys to get that set up. So for those of you that are going to be using Thera EVV, our full EVV platform, this is where those initial calls are going to focus to get you guys set up and ready to go. Now, the other group that are choosing to not utilize Thera EVV platform, but instead are using your own selected vendor, what we refer to as your third-party vendor, so an alternative EVV system where you're going to collect your EVV data there and then send it over to the Thera aggregator. You guys are going to have obviously a different onboarding process. You're not going to be using the entire EVV platform within Thera. So rather than a one-on-one call with one of our specialists to set up an account, what you're going to get from us are some business user agreements. You're going to get some requirements, what we refer to as our EVV vendor attestation requirements, as you can see on the slide here. You're going to get that information from us, which really outlines the criteria that need to be in place for your selected vendor to be certified to meet standards there. And we're going to work with the state on identifying that as well. You're also going to get from us a business associate agreement, or BAA, to sign off. That's going to go to both you as well as to your selected vendor. One of the questions we're going to ask of you guys is to identify for us who is the vendor that you're choosing to work with and who's the primary contact there to whom we should be able to send this information. Again, you're going to get all of this directly through the job form, but just to anticipate that, that's what you're going to see from us. And then lastly, you're also going to get another agreement, the End User Legal Agreement, or EULA for short, that you will need to sign off on that we have for all of our users. So you will get that as well. And that we will also have an End User Legal Agreement that goes to your, it will go over to your vendor of choice. So those are the documents that you're going to get to us. You're going to receive them via DocuSign. And then once we get that information back from you, we will begin proceeding through the process of getting you guys linked up with the API specs and really the certification and approval process. That's when that will kick off. We have technical folks on our side they're going to work with. I know the state would like to be involved with getting those third-party vendors up. But the first piece is going to be the returning of all of those agreements. I do want to put out there for any of you guys who may have already done your initial submission. I know we have sent out agreements to several providers, and I know for several we've not yet gotten them back. You guys may well be reviewing the documents, talking about them internally, which is perfectly fine. Certainly, if you have questions, let us know. But we do look forward to getting those back from you, and once we do, we will proceed with the rest of the process. Now, once we go through all of this, you guys will, or your vendors, I should say, will be able to develop and test at their own schedules with support from us. Again, we have a technical specialist on our side that will be available to help with that process, but we will provide you the necessary specs to go through the certification. Obviously, all of these activities will be required to be completed prior to that January 1st go live date. That will be the date that you will have to be able to collect data and then send over. So that stuff will have to be done by then. So that is kind of the third-party vendor process. And I do know, like I said, we've heard from several of you that you guys are anticipating going in this direction. So certainly we encourage you to get that information submitted and get those agreements done so that we can get this process moving forward. Now, regardless of whether or not you're going to be using the Therap EVV platform or the third-party vendor, you're all ultimately going to be sending data to the Therap aggregator. As I mentioned from the beginning, we really are providing kind of effectively two platforms to you. There's the EVV platform for the data collection, but the second piece, and the one that everybody's going to be using, is that Therap aggregator, because your third-party vendor is going to need to be able to send data over to our aggregator. And so that will be the final piece of the training that we provide kind of as part of your administrator training, because even if you're not using Therap's EVV collection, we will train you on being able to access the aggregator to make sure that your data is flowing over into that, because that's the data that's going to be used to ultimately validate the claims that you're sending over to MMIS and or to your MCOs. So we're going to be working with you guys to do that as well once you've moved through that initial onboarding process. Now, in terms of resources, we've got a lot of resources available to you guys. Again, certainly the one time spent with our support specialists are going to be extraordinarily valuable, I think, kind of walking you guys through that process. We're going to have ongoing instructional webinars covering particular aspects of system use. As I said, on the last town hall, we gave an overview of EVV and billing. That has been recorded and will be made available to you now. We've actually posted that on our site, which you can see here at the bottom. I'm going to show it to you in just a moment. But all of the other training materials are available to you guys as well, right off of our public site. So I certainly encourage you guys to go check that out. I'll actually click over there right now so you can take a quick look. It's at the help@therapservices.net at Kentucky EVV. If I click on that, as you can see, we've set up a dedicated page in partnership with the state that provides you guys a ton of resources on here, including, depending on your role, we've got user guides. So if you're an administrator, how to create users, we've got specific user guides that will show you how to complete all of those necessary steps. And you can go through and check on all of these and get the necessary information that you need. What we've also done is created a page for the recorded town hall meeting. So if I click on this, you will see here is a recording, and the state's hosting this on their YouTube site, but this is the first town hall that we did a little while back. We've now got that posted and it's available for you guys to check out. Certainly we're recording this one and we're going to get it up as well once we get it completed and prepared so that you guys will be able to access that. And then the last thing that you're going to see, well, actually a couple of other things. I do also want to mention here while I've got this page open, the billing service codes, because we've gotten some questions from folks about what particular services are included in this requirement. For the home health requirement, these are the services that are included. So we put these here for easy reference, so you'll be able to go over and quickly see that information. And then the last thing, and we're actually in the process of getting this posted now. Hopefully we'll have it up within the next day or so. Excuse me. All of the frequently asked questions that were asked in the last town hall, and certainly the ones that I know there's some coming in right now in this one, we're going to collect that data as well and get them answered. We're going to post those and have them linked off on this same page as well, so that you're able to go in and see that information. I will go ahead, just so that folks have it. Let me go put this into the chat so that you guys can. Here, so that you guys can quickly access it. But again, you'll be able to get to these recordings and all this data is going to be made available to you as well. But those are some of the kind of an overview of some of the resources that we are providing as part of the admin process. Now, the one other piece of training that I want to reference, again, we're not there yet, this kind of comes a little closer to the end, is after we do all of this setup and get everybody ready, obviously we need to train your caregivers, your direct support workers, the folks that are on the ground providing services to individuals. And we do have a training process ready for them that will come at the end of this onboarding. And a lot of this will be done through public webinars, very much like the forum that we have here. that we're going to have live and available to you, but we're also going to record and make available on that site that I just shared with you. So they'll have reference to it. You'll also notice when you visit the Kentucky EVV support site that we've got a lot of references in there specifically for DSPs to be and caregivers to do the particular steps that they need, which is largely going to focus on just accessing the app and getting logged in, and then the checking in and the checking out. That's a really kind of the foundational piece of what is required for EVV service provision at the caregiver level. And so that's where a lot of that's going to be focused, and we'll be doing a lot more of that information on these town halls as well as we get a little bit closer to the go live date and get some of these other pieces completed. So that's kind of the background information that we wanted to cover. I know a lot of that was repeat from last week, but certainly wanted to make sure folks got an opportunity to see it again. And what we want to do with the rest of our time today is to go back through some of the frequently asked questions that we collected from the first call. And as I said before, just as a reminder, we kind of consolidated these down from some of the questions that were asked and put them into different themes. This does not include every single question that was asked. There are a few more that will actually be included on the posting that we do, but we tried to focus on those that we heard the most so that we could get those answers out to you. And so I want to work through them and address these as we can. The first one being, is that their mobile app both iOS and Android compatible? Yes, it absolutely is. You can find support materials for both of those, as you can see, for both Android and Apple. I can just click right on that, and it will give you information on how to do that information directly from our site. Same thing with Apple. And these links are useful, but again, we're going to be providing you additional training on all of these pieces. But those links will be available to you as a resource whenever you need them. We've also gotten several questions about our EVV platform's offline capabilities in the event that your internet service is down or you're in a remote area and don't have it. We do have offline capabilities. I'm not going to go through all the specifics of how that works. Again, that's something we'll talk about in greater detail, specifically with you and your staff, with our support specialists, but we do have resources available for you guys to see it. And again, we're going to be providing a lot of additional training, but for today's purposes, I do want to make sure that folks understand that you do have offline options available in the event that you are not able to access internet service. A couple of other EVV specific questions that we had. We had a question come in that I wanted to explain to folks just to make sure it was clear. Is what will happen for a user that attempts to check in for a service, to self-check in for a service if there is no authorization present for that service? Now, many of you guys probably know that an authorization does exactly what it sounds like it does. It authorizes an individual to receive a particular service. It defines what service they receive, the number of units, the rate, all of that good stuff. And if we don't have an authorization in place, we can't bill for that service. And therefore, their EVV platform is built on the presence of an active service authorization. That's kind of foundational to how it works. We got to have that off in there to be able to check in and provide EVV to that individual. So if a staff member tries to do a self-check-in, they try to go in and check in for a service with an individual that does not have an authorization or has an expired authorization, it's not going to allow them to do that self-check-in. They will get a message on their app that says that there's not a service found. There's no service found. Will be shown to the user, and they will not be able to proceed with the check-ins. We wanted folks to understand that. Again, this is going to be information that we cover in greater detail as we continue to go through the training process, but we got several questions about this kind of thing, so we wanted to address them publicly so that you guys knew what to expect. And again, we'll talk about it in greater detail through the training. There were also several questions around what to do, and I think the term that was used was an emergent caregiver situation, but essentially it's when a user, perhaps they arrive at a particular address to provide a service on time, but due to a client being in distress or some otherwise urgent set of circumstances, they're not able to check in. They have to immediately provide support or do something relative to the individual because it requires an emergent need. What do we do there? Because then by the time they get around and check in, it may be 20, 30 minutes, an hour, who knows, into the shift. And we want them to certainly be able to get paid as well as to be able to bill for the service being provided. In that scenario, it is up to the user to clock in as soon as they are available, but they may need to contact their schedule administrator or they will need to contact their schedule administrator to explain to them the reason why there was a late check-in. Folks with administrative privilege within your EVV platforms will have the ability to go edit a check-in to note what the actual time of arrival was in the event that somebody could not check in when they needed to. And so that schedule administrator can go in and make that change. They will be required to document what's referred to as an exception code. Any of you guys that have spent any time with EVV knows what an exception code is, but for those of you that have not, an exception code is essentially a code that's entered into the system to indicate when a manual edit or change had to be made to EVV data, that it wasn't a true on-the-spot check-in, check-out through the mobile app, that there had to be an intervention to that, a manual edit to that. An exception code is required to explain the reasons for that. And so your schedule administrators will have the ability to do that, to document the reason that the edit was necessary. Moving on from EVV, I want to talk a little bit about the aggregator. And again, this largely, I think these questions are coming from folks that are using our third-party vendors, but they're certainly applicable for folks that are utilizing the Therap EVV platform as well. And so generally speaking, some of the questions that we got kind of fall into the two buckets that you see on your screen. First of all, how do we get more information on the Therap aggregator? And so what we've tried to do here is to provide you with a solid explanation of exactly what this thing is. Again, the Therap aggregator is a repository to which all EVV data will be sent for aggregation, regardless of whether that data is captured through Therap's EVV platform or through your chosen third-party vendor. You're going to be collecting that data on the front end. It will then all come in to the Therap aggregator. And again, we're going to work with you to make that integration so that the data flows over, but it's all going to come in, and that is the data that's going to be used to validate the claims that are getting paid by MMIS, Kentucky Medicaid, as well as your NCOs. So that's kind of the upshot of what the aggregator is and does. You guys will receive logins and get shown how to log in and see your data within the aggregator so that you know that it's getting in there. But all of that will be provided as part of the training that we offer to you. So that question then, how does the data get into the aggregator? Well, that's going to depend a little bit on whether or not you use our platform or whether you use a third-party EVV vendor. If you use our platform, it goes over in near real time. I won't say it's exactly real time, but very shortly, within a short while, it will go over into the system and you'll be able to see in the aggregator. If you choose to utilize a third-party vendor, you'll need to speak to your particular vendor about the specifics of how they do data exchange there. Now, having said that, part of the certification process and part of what we're going to be working on with your vendors is they have to meet the minimum expectation of the state that data exchange be occurring at least weekly, which I would think most of them are a little more frequent than that, but that is going to be the minimum expectation. But we'll work with your vendors on that and certainly let us know if there are questions on that as well. Now, the billing side, as I said earlier, and again, we'll reiterate this many times as we continue to go through, that this piece is optional. So the biggest question we got this from a lot of folks, understandably. So it's like, do we now have to submit our claims through Therap's billing system? And the answer is no. You are not required to utilize our billing system, but it is available to you as an optional service as part of the state contract should you choose to utilize it. So if you want to use our billing system, we're going to show you how to set it up. We're going to show you how to submit claims through it. But if you don't want to use our billing system, you absolutely have the option of continuing to submit your claims to MMIS, to your MCOs in the same way that you currently do. Nothing necessarily has to change about that. So we want to make sure that folks absolutely understand that option. Also related to billing, and this is a question that we'll continue to have more clarity on as we get a little bit closer to go live, but I know a lot of folks are curious, and understandably so, about a claims impact date set. Has that been set yet? Essentially, at what point will this affect the claims that you're submitting, the approval of claims, and all of that sort of stuff? We can tell you that immediately upon go live, we're going to be doing essentially what's called a soft launch, which effectively you're not going to get claims denied immediately. But ultimately that will happen. We have not set the date of that. As we get a little closer and the state determines exactly what date they want that to be, it will be communicated out to you guys so that you are aware as soon as that is available.
As I say, and Jason, I can just step in and just add to that.
Please.
What we're going to do, so in that period of time, what we're going to do is we're going to be monitoring that, so that'll be time for us to provide some technical assistance to providers, so to let you know, okay, these are the things you need to fix before we turn this on, so that ultimately, once we do make that a kind of a hard edit, that it will not pay the claim without the EVV data, that it will, you won't be surprised if there's something that maybe there had been a pattern before. You'll have time to fix that before we actually turn that on. So that's the whole kind of the background behind that.
So thank you, Pam, for that clarification. All right, what do we have? So we have a few other questions that came in. I think most of this we've already addressed, but they were asked quite a bit, so I wanted to make sure to get them into the slides. If you're choosing to utilize the third-party vendor, who needs to sign that? Is it you as the provider agency or the vendor? And the answer is both. We're going to be sending that business associate agreement to both of you for signature to sign off on as part of the initiation process for utilizing the third party. Where can we find the training videos associated with this? Again, all of that information is going to go to the Kentucky specific EVV support page, which we provided before. We currently have the initial town hall up there. As we continue to record more videos and more training resources, that's where they're going to be. So definitely keep an eye out on that. And as we go through these town halls week by week going forward, we'll continue to let you know of updates that have been added there, so you know when to go back and check out new information that's available to you. And again, a few additional miscellaneous questions that came in. And again, I just mentioned that the recordings and town hall slides, that information is going to be available. The first one's already up there. We'll continue to do that. Again, can't emphasize this enough. The second question that you see on your screen right here, I mentioned it earlier. If you have not yet received communication or outreach from TheraP about the onboarding process, please reach out to us at the website, at the email address that you see on your screen at kysupport@therapservices.net, or you can certainly reach out to the state at the Medicaid public comment email address on your screen. They'll work with us and we will make sure we get you the information that you need. Again, when you reach out to us, please provide your name, contact info, and the name of your provider organization and provider number. That's going to help us really narrow down who you are so that we can follow up directly with you to initiate this process. And if all else fails, certainly there is a phone number available for you to do that as well, as you can see right here on the screen. The last question that we have here is around the required services in this EVV requirement. And without going through the entire list, I'll again refer you guys to the EVV support page where we list them out. So I'll go back over there again just so you guys can see it. At the bottom of the page, we have listed out all of the services that are a part of this initial phase 1 requirements at the end of December 12/28, again with a 1/1/24 required utilization of EVV for these particular services. There will be additional services for personal care later in 2024. The specific dates are to come, and we'll keep you guys aware of that. I think there are a handful of you guys that provide both home health and personal care, so we'll be sure to keep you informed of that information. And I think those were the primary questions that we have. Now, I know that we've had a lot of questions coming in through the chat over the course of this. And so there was some discussion between us and the state. I think what we want to do here is, rather than try to answer all of these live, we're going to collect this information and then get some formal answers and get those back out to you. We think that'll probably be a little bit organized and manageable a way of getting all this info to you. So we will work on that and get that distributed back out to you. As I said earlier, we're going to be posting the FAQs on our site. I know the state is going to be doing it on their site as well. So you'll have multiple options for being able to access that information. And again, as a reminder to everyone, we're going to continue to do these town halls weekly. going forward with the next one a week from today, same time. We expect to do these every week. As you can see, I put a subject, maybe subject to change as we get close to the Thanksgiving and Christmas holidays and perhaps others. If we do have any change to this schedule, certainly we'll be working with the state on that, and we'll communicate that stuff out to you. We're going to try to get the registration link for these from the state, and we'll get that communicated out to you guys very soon as well. And otherwise, I think that was the gist of what we wanted to communicate today. So again, I appreciate you guys taking some time this afternoon. I know we didn't go the full hour and a half. I think sometimes we'll probably take the full time. Other times it may be like today where it's a little bit shorter and more focused. But I do appreciate you guys joining in. I very much appreciate all the questions that I've seen come in. We will work with that to quickly get that information consolidated and get the answers back out to you. And before I close this out, I'm going to ask our friends at the state if there's anything else, Pam or Kelly or anyone else that you'd like to share before we close the call.
I do not have anything else. I know I've seen a couple of questions about the PowerPoint. We will check on that. And as Jason mentioned, consolidating all of these questions, and we will get those posted and out there for you all.
All right, very good. Thank you very much, Pam. Again, thank you, everyone. We'll let you guys go, and we will speak to you again soon. Take care, everybody.
Thanks, everybody.